Hello, everyone. This is live Q&A, episode 8. Episode 8, I think. If you join, just put your questions down and I answer live. My name is Mallory Miette. I am a speech pathologist, infant feeding specialist, craniosacral therapist. I specialize in infant reflux and oral development. And so if you have any questions related to infant feeding, we're going to talk about that. Some people left questions on Instagram. Oh, but disclaimer, I'm not your therapist. So this is like general information and guidelines for you to push for answers or seek an assessment. I don't know why this is not working, but it's not letting me open questions that were left on Instagram. So give me a second. It's so weird. I think there was like 5. This week on Instagram, we talked about high chair support. And so I do want to mention that really quick, is that a lot of parents will see that baby needs to be sitting upright on their own before you start solids. And that can be harmful if for babies who are struggling motor wise. And maybe you're in therapy for that. Why are we holding off on then preventing them from developing with another skill? So those are indicators that it's a good time developmentally to start. But if you already know that they're behind motor wise, then let's give them some support in their chair to make sure that they're stable, that their core is supported so that we can be working on hands to mouth and swallowing. Another one is that a lot of times babies will be prop sitting on their own. And when they're put into the high chair, if they're smaller, the high chair is just really big. And so they'll start to lean. That's not indicating that your child's not ready for solids. It just means they need more support. And so rolling up some support to stabilize their core can be helpful. So that was the point of that post, and I hope that it was helpful for people to see. I'm really upset that it opened. Okay, so let's get started. When baby is eating, his tongue can't be cupped around the bottle nipple. How to help? So if the tongue can't cup around the nipple, then we need to look at why. So is there a restriction? If there was a restriction that was released and we didn't do pre and post work, or if there's no restriction and there's just lots of tension anchoring the tongue down, that's where your oral play comes into the picture. You have to get under the tongue and release that tension. All of those activities are in the oral play guide if you want more of those. But if the tongue isn't doing what it's supposed to, we need to help it, but we need to understand why it's not. So is it restricted? Is it just tension? We need to get under the tongue, but we also need to do those big body movements to release tension wherever else it is. Because remember, the tongue is connected by fascia all the way to the toes. So we need to be addressing the whole body. The other thing to, dang, I had a good point and I just lost my mind. The other good, the baby's not cupping. We're looking at tension. We're looking at oral restriction. Suck training is another thing that's often recommended, where you put your finger in the mouth and you teach them to suck. Suck training is also in the oral play guide. There's lots of programs for suck training. My caveat to that is I usually don't waste my time if the baby's older than 4 to 5 months. Their suck reflux is gone by that point. It's really hard to train that when they have such an established motor skill, especially motor plan, especially if we're not addressing the underlying problem. So, Suck training is something that you can do with oral play and those big body movements, but don't expect it to be like a miracle if if they're older than the 4 or 5 month range, because suck training they don't have that reflex. They're working against a motor plan that they already established, so it can be harder to develop. Sorry, my nose is itching. How to handle regression of open mouth posture due to constant illness. So we have to look at um, whenever baby's sick, they're gonna have their mouth open because they want to breathe. We need to make sure during that sickness we are doing lots of oral play, getting underneath the tongue, those big body movements. Again, we're looking at the body in a whole big picture. So anything that causes tension to the body or to the mouth, we need to be addressing it daily. So I say it as a response to a lot of different things because that tension is a result of many different things. So baby's sick, we have their open mouth posture. Don't wait until baby's not sick anymore to be doing things that will help promote it when they're ready. So, getting underneath the tongue, doing palate stimulation, your nasal hygiene during sickness is even more important because one, we want to clear all that out, and two, we want to make sure that we're keeping that airway space as healthy as we can during the sickness. So, and then do your nasal breathing practice. So you can practice even when they're congested and sick. It's just going to be for shorter periods of time as they're tolerated, and also depending on age. So we want to make sure we're doing all those things so that when the sickness ends, then the muscles already know what to do. And so when they're capable of doing it safely, it will happen more easily. And then maybe we add some taping when the sickness is gone to give them that extra input in the mouth, and help support that. But sickness will always cause a regression in nasal breathing because they have to be able to breathe. So the mouth will drop open during that time. It's unfortunate because babies it's like a cyclical. They're getting sick. So then we need to ask what's going on and why are we getting so sick? Then you have to look at, are we using antibiotics too much? Um, you know, your body builds up immunity to things, including immunity to antibiotic effectiveness. So we need to be we need to look at that, and I think that's like a huge change that needs to happen. But and I know from a working mom perspective, I have like the daycare won't take them back, right? And I have to go back to work. And so I can't afford to have 5 days at home where I allow their body to naturally get rid of this infection or this virus. Um, and so that is a valid thing. But we do need to look at, are we constantly getting sick because our body is depleted of what it needs to fight off some common things? Um, so when you're on antibiotics, let's look at probiotics so that we can get that good gut health. That may help um, rebuild some immunity. Um, if you're looking at constant ear infections, then let's do some um, movement in the ear. These are in the baby unwind guide so that we can make sure we're opening those eustachian tubes. We're opening the passageways so that everything is clearing out the way it needs to. Doing simple face massage every day can help clear out all of this so that we're not building up allergens and intolerances in our airway space, which then leads to virus building and congestion, right? So there's things we can do preventatively um, to help those little I mean, I understand it's just like they're always sick. Um, and then if you live somewhere like me, I live in Louisiana and the weather is constantly changing. It's hot and it's cold. Literally, it will be 30 degrees one day and 80 the next. And that causes issues with the way the body's responding to the environment and what is floating in the airs, and all of that matters. Um, so yes, while I always like to include, if we're getting sick, literally, like, they get better for a day and then they have another sickness, and they get better for a day and they have another sickness. It should be looked at why. I work with families who struggle with that. Um, and I think it's so super common to just say, well, they're in daycare, they're sick babies. And I hear that all the time. Um, and so maybe just some things to think about on the side. But if you're in the middle of a regression because of sickness, make sure you do all of those little things, because when the sickness goes away, those muscles and that routine and that knowledge, the muscle knowledge will be there, and it will be easier to get back. So my kids go through the same thing. And I you let it go for that sickness period, because they have to breathe. You put in those little measures, and then when they're not sick anymore, we're doing taping, and we're redoing, we're getting that munchie dupe, practicing our nasal breathing, and getting back on track quicker. Than it shouldn't take you as long as it did the first time we taught nasal breathing, right? Because that was weeks and months of them having this motor plan. This is just a little setback. We can rebound quicker. And then the more you do it, the faster their rebound is. So I hope that helps. I know it's frustrating. And it's like, gosh, we just got it. And then they get sick again. Um, but some things to think about. When to start solids if still having consistent reflux at 6 months. Um, I'm sorry you're still having reflux at 6 months. That is tough. It depends. When to start solids, I would start right now, because you don't want to delay all the other things that come from starting solids: hand to mouth, um, oral awareness, texture, acceptance, all those other things that are integrated with feeding, you don't want to not have. And so you start right now. You don't wait to start solids. What food should you try? I would stay away from. So it's like, well, why is baby still having reflux with milk? Is it an allergy or intolerance, or are they still having motor deficits? If it's motor deficits that are the problem, usually starting solids can be beneficial, because it's a different motor plan. They're intaking less air, unless they have like unless there's a lot going on and they're still taking in lots of air. If it's an allergy or intolerance that was never resolved or solved, um, then I would probably not do wheat and gluten, because that's the hardest for them to digest until they get older, until they can break down. When they start to get their teeth in, um, they can break down those um, foods better, and the digestion gets easier. But at 6 months, you're just starting with, like a raw carrot stick and some puree banana. Um, or a banana, a carrot stick, and some squash. you know I wouldn't delay the start of solids. You might find relief from the reflux, and it may help you see where the issue lies. It can make it worse. That's usually when there's some sort of intolerance going on, unless they have that severe motor deficit. When breastfeeding on demand, how to set a schedule for starting solids. You pick a time. So you're feeding on demand, but usually there's some sort of routine in that situation. Usually it's about they eat about every whatever time frame. And so you start, if you're just starting, you're gonna, at 6 months, you do one meal. At 8 months, there should be two. At 10 months, there should be three meals. And then by 12 months, there's three meals and two snacks. I know if you're breastfeeding and you plan to continue, sometimes the snacks stay breastfeeding only, and food is never added as a snack. So you could do it that way too. For bottles, it's eliminated and it becomes a snack with water. And so pick a meal that is easiest for you to start with, breakfast, lunch, or dinner, and you just pick a time and you stick with that time. So if you want breakfast to be at 8:30 every day, then I would, if they're breastfeeding on demand, make sure they get a feed in by 7:45, 8 o'clock, and then set them up at the table for 8. And then go that way. And then do the same thing. You keep adding in meals as they like to. Sometimes it's sooner than 10 months before you add that second, 8 months before you add that second meal. If they're doing really well and you guys enjoy it. But there's no reason you don't have to set up a schedule for your breastfeeding. You do need to set up a time frame, consistent time frame for meals, to build that relationship with food. Can shallow latch cause reflux in 13-month-old? Revised tongue tie and craniosession didn't work. Can shallow latch cause reflux in a 13-month-old? There was a revised tongue tie. Shallow latch can cause reflux in any child. Shallow latch, so I'm assuming they're breastfeeding. So you're going to continue breastfeeding. How are they doing with food? What is food doing for them? By 13 months, we should be, at a toddler diet. So are they doing well with that? Because I would suspect that if you're still having a shallow latch that's causing reflux with breastfeeding, that maybe solids aren't going too hot. Are they not able to move their food around? Are they staying on purees for a long time? Are they not consuming a good volume, etc.? Craniosession didn't help. Did you only do one? I always tell my families to expect at least three, and then we go from there in terms of our plan. But three is a good number to see what differences that can make. Not all therapists are created equal, so maybe baby just didn't respond to that craniosacral therapist. It doesn't mean craniosacral therapy isn't going to work. It means that maybe they didn't address the right thing, or maybe they didn't they weren't good for your child. All right, like there's so much that can go into that question. Yes, shallow latch can cause reflux. In a 13-month-old, I would assume we're looking at other things going on, like solids. You got your tongue tie revised. If you're following me, I'm hoping that you've been doing oral play. What does that look like? Are they still restricted? Are they carrying tension somewhere? Maybe consider the baby unwind guide, because that helps you walk through the body and find where they're holding that tension. Something's going on. Is it an allergy or intolerance that we haven't found yet? 8-month-old squishes food in the hands, plays with the food, not able to eat or self-feed. He's not able to, or he doesn't want to. That's a really big difference there. Or self-feed. Why? Like, you don't see them bringing the food up to their mouth. Do they bring other things up to their mouth? Do they understand the purpose of food? A lot of times we get into, and then, so like I always want to look at this schedule, and I know people hate that when it's surrounding feeding, but there is a routine that is built within the body, and time frames can be different for everyone. And that's why it's not a strict schedule. I'm not saying you have to feed your kid at 6, 9, 12, 3, like it. I'm not saying that. I'm saying that there is a routine that bodies follow when they're listening to their hunger and fullness cues. And so when I'm looking at an 8-month-old who just sits there and squishes food, My immediate thought is they don't understand the purpose of food. So why don't they understand the purpose of food? Are they not hungry? And I'm not saying I'm not saying serve your baby when they're starving, because then you're shutting their body down. And I talk about that in bottle refusal. So we don't want them to get so angry and hangry that they don't know what to do, because it's not like an adult, even as an adult or an older child who gets hangry. And you ask them, if I ask my child, he's acting like a all over the place, screaming, he can't control his emotions, and say, "Are you hungry?" He always tells me no, because in his mind, he's not hungry. He's angry, he's frustrated, he's tired. Um, but I give him food and he regulates. And so a baby is the same way. If they get over hungry, they're not one, they don't even have the relationship with food in order to say whether they're hungry or not. And then you're not fulfilling their need because they don't know what to do with this. And so look at your routine as in, let's set up a time where we give enough break between one meal and we don't immediately feed after the table food session. So whether you are bottle feeding or breastfeeding, the meals you choose, there needs to be an hour, hour and a half after the last milk session to when you sit them down in the high chair. Hour and a half, hour and 45 minutes. Depends on the baby and it depends on their schedule. Um, and then whatever happens during that meal, we don't immediately take them down and give them milk, because then then they think that they did what they were supposed to do with that food, and then their hunger is sated with milk. So you have to develop the relationship with food, and they develop that by understanding what it does, what purpose it serves. And that is to fill your body. So they have to have some sort of, they can't be, I don't want them starving. Um, and they can't immediately get down and get milk, because then they're satisfied with that and they continue to grow their relationship with the milk and not understand. They probably think playing with it is all they're supposed to do if they get down and then that's it. um and so, but the other question is, just plays with the food, squishes the food. So I'm guessing it's soft. So do we have anything hard on the tray where they can like munch on? Um, are you eating with them? Do they see you eating the food and so then they copy you, because that's huge. Um, so there's some things to look at. At 8 months we should be up to 2 meals, right? So they don't have to be full meals, but you're sitting down for 2 meals and they're consuming something. Until you start to wean milk, they're not going to, some babies eat a lot, but some babies just kind of, they understand the purpose, they eat, and when you start to wean milk, they increase food because they've developed that relationship. So we need to look at timing, we need to look at schedule, we need to look at their environment. Are they watching you eat? And we need to look at what's being offered. And do they put things in their mouth outside of food? Do they have that skill? Are they aversive to touch in the mouth? Like, can you get in their mouth and play? Because then that's a whole other issue. What are some of the signs of oral dysfunction you might see when starting solids? So, oral dysfunction, there's some things that happen that indicate oral dysfunction if they continue. So you hear a lot about a tongue thrust. Baby takes the food, you put it in their mouth, and they immediately do that, and it squishes all out their mouth, and they barely eat anything. The tongue thrust is a normal part of development, but starting solids decreases that tongue thrust response, or it should. And so, if you're starting solids, the main thing that you need to do is make sure that baby is self feeding. So whether you do puree or you do baby led with soft solids, I don't care, as long as baby's the one bringing it to their mouth. Now, for parents who are working on volume because of weight or other issues from that you've talked to your doctor about, you give them a spoon where you load their spoon and they bring it to their mouth, and then you can have a spoon where you're specifically working on volume. But make sure you put the spoon in their mouth, you pull the spoon out, you don't scrape up on their teeth, you allow for that lip closure, and you don't let them, and you don't hold the spoon in their mouth. You put it in and you pull it out. And so them self-feeding though gets rid of the tongue thrust. The tongue thrust is there, so we put the spoon in and we pull out, and they keep everything in the middle. If they're self-feeding, usually they jab themselves in the cheek or they hold the spoon and will suck on it, which we want them to move away from that too, right? That's an early behavior. And so if you're stuck with the tongue thrust and the baby has been feeding for a couple of weeks and they're not getting rid of the tongue thrust, look at your environment first. Make sure that they're self-feeding, that you're eating with them, right? Make all of those changes, then see what happens. For what to look at for the tongue is we need to be seeing the tongue moving from side to side all around in the mouth. We don't want to see this, okay, where baby is tight and they keep everything in the middle and then just suck and swallow it down. We want to see them moving food around, which is another big piece of the self-feeding, right? Because they're not putting it right directly in their mouth. They're moving it around, and that's why you get different textures and things like that. So tongue movement is what I look for. Are they holding on to their tongue thrust and not learning different movements? Can the tongue move side to side? So you can take your finger and guide it along the gum lines, top and bottom, all the way back. Do you see the tongue reaching for you, or does it stay in the middle like it can't move? So that's a good sign. When you're starting solids, that's pretty much what I look for. Like, what is baby doing with their mouth, and are they able to move in different planes and explore, or are they just tight-lipped and keep everything in the middle? And it doesn't necessarily mean that that's going to be a problem. It means let's change some of these things and see if it improves, because maybe they just need bigger experiences. Okay. So all of the questions were like related to starting solids, which is interesting to me. That they all had that theme. So I will post the answers to these. Nobody joined the next question. So I will see you guys on Tuesday, and we will do this again. Bye.